Welcome to NYC Health Hospitals Kings County's YouTube podcast. I am Dr. Melvin Stone, Chief of Surgery.
I am Dr. Valery Roudnitsky, Director of Trauma.
And I'm Fred Harry, Trauma Program Manager.
Welcome to our YouTube podcast takeover. On this episode, we'll discuss the top 6 things we never do as trauma specialists.
So I will never drive while intoxicated. In addition, I would never use any CBD products and drive a motor vehicle or even ride a bike.
Now you said CBD, right? What about marijuana?
Absolutely, I would not use marijuana and drive.
Okay, all right. Well, you know what I wouldn't do? Work on my own roof or anything high up where I could get somebody and hire somebody to do it. I've seen too many people try to do their own work to save money and end up with serious spinal injuries, all kinds of fall injuries. What about you, Val?
I would say I would never drive motorcycle or ATVs. Thanks God we don't see many ATVs here in New York, but those rare cases that we see, the young people driving ATVs without helmets, violating all possible rules in New York City and getting to such a big trouble, such a serious injuries, losing their lives, and I would never do this. Motorcyclists, as well, not too many we see because the Bell Parkway is far away from Kings County Hospital, but those rare motorcyclists, they're usually multi-trauma patients, they have multi-organ injuries, they never leave hospital actually going back to home, but needs to go to some kind of facilities and rehabs. And the most horrible thing you can do that I never would be, it's actually try to drive motorcycle or ATV without helmets, which is a horrible idea. But again, looking these injuries, looking these patients, they are young people. I don't want to do it.
Probably add in there for motorcycles these new electric scooters that can get up to speeds. The electric scooters I used to with motorcycles.
Yeah.
And what's a fender bender on a motorcycle? I mean, is a life death. Right?
Correct.
And one thing that I wouldn't do, and I till this day, I yell at my kids about it, and I do it myself, is I don't stand on the edge of the curve when I'm waiting across the street. You go in any city in America, and there's always these stories about cars driving up on the curb and hitting people. And I especially don't do it in New York, so I tend to just, even when I'm hailing a cab, I'm pretty cognizant of, where I'm at when I'm doing that. How about you, Fred?
Yeah, well, I think, like you mentioned helmets, I think with the new bike lanes that we have all over the city is really great. But one of the things I would never do is ride a bicycle without a helmet. In addition, I would not even ride a scooter, for that matter, without a helmet. Given those increased speed, we have seen patients who have came in with significant injuries as a result of collisions. So certainly, I would use a helmet each time I attempt to either ride a bicycle or a motorized scooter or bike.
You know what I'd probably add to that is having your headphones rocking on your...
Absolutely. You need to be aware because they're so silent. It's difficult for other drivers to even know that you're in their vicinity.
So you can just add that as a prime.
Yes.
Val, anything else you wouldn't do now that you're kind of traumatized?
Yeah. Another thing I'm always do and never willing not to do it, it's to drive car without using seat belts. My kids think I'm driving them and everyone crazy in my car, insisting for a seat belts in the first row, in the second row, in the rear row. It doesn't matter how many rows your car has. You gotta have everybody to put seatbelt before you starting to move. So I never start to drive my car without seatbelt. And seeing the patients here in the emergency room, those who, drivers and got to the trouble, the car accidents without seatbelts, it makes a real big difference in terms of sometimes saving your life, and sometimes saving life and giving you less injuries or less degree of injuries, or sometimes avoiding even injuries at all. So I think seat belts is absolutely essential. In private cars, that's the mostly, but I know the kids are frequently having trips in the school buses, and there is a seat belts in the school buses, but I know that kids trying to avoid or to remove those seat belts when they started to move. I would highly recommend to everyone to keep it on, and for all parents to instruct kids to actually to comply with rules, school rules and school bus rules. Yeah, seat belt is critical for me.
Seatbelts save lives.
Sure does.
I think there are probably 60 more things that we could put on there, but those are the big six, wouldn't you say? All right.
Absolutely.